So, can you see my screen? Can you see my screen, guys?
Yes.
Yes, case one,
Yes.
case
Yes.
two.
Yeah, exactly. So, Saida, you are there. So, when you're ready, tell me. I will start the 3 minutes timer. Are you ready to
I'm
start? There is no
I'm
much
ready.
there, but I want to tell you something.
Yeah.
Yeah, there is no much there, okay?
Mm.
But this is your time, okay? This is the time that you need to use even in the exam. If it's small amount of information there, so you need to try to think about what might the patient, coming for, what is the presentation is, and your white in your whiteboard to write, small scratch about what's the possible question you will ask, okay? The other thing is, to put your scheme, okay, open question, closed question, differential, management, ICE, on the side of this whiteboard, so you will not, forget what you need to do with the stress. Okay.
Sure.
So use your 3 minutes to think
Mm-hmm.
about what might the patient come with, and
Okay.
then after the 3 minutes we'll start the 12-minute timer, and then after that we'll discuss. Okay.
Okay. Sure.
Yes, say they couldn't start.
Good evening. It's Dr. Saida calling from surgery. Am I speaking to Mr. Apple Adam? Adam Apple.
Yes, 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 thank you for calling, Victor.
You're welcome. Am I right to call you Adam?
Yeah, sure, sure, doctor.
Hi, Adam. How can I help you today?
Well, doctor, I have this headache that I'm not sure is it headache or not, to be honest. It's just a stabbing pain coming to my right side of my head.
Hmm.
Initially, I thought maybe it's something related to my teeth, and I went yesterday to the dentist. He did examine
Hmm.
my tooth, and he find everything is fine in my mouth. And then he told me, "Oh, this is a
Hmm.
migraine. Go to your doctor and go to your GP, and he might prescribe some medication for you." So
Sure.
that's what I
Okay.
came. Yeah.
Yeah, sure. We'll talk about that. Okay. So, other than discussing this headache, is there anything else you are considering to discuss today?
No, no, actually, no. It's just this pain that I cannot tolerate. To be honest, yeah, it's just nagging pain. Yeah. If you
Sure.
can just take off the edge of
Okay.
the pain, I will be happy. Actually.
Okay. Sure. And yeah, I mean, we will talk about how to support you best. But have you got any idea that of what I should do to support you regarding this headache?
Well, I'm not sure, doctor. I'm not sure what is the cause of the pain. I Google
Okay.
it.
Yeah,
I
we will
did
talk
Google
about
it.
that.
Yeah, I Google it. Then I find the all nasty thing this in the Google. Then I become scared. They said
Hmm.
maybe tumor, maybe something. So I said no, research. Yeah, yeah. So
Hmm. Oh, I'm sorry. It sounds like you're quite concerned about this headache.
yeah.
Uh, okay, so should we talk about? Tell me a little bit more about your headaches.
So what you want to know, doctor?
When did it started? Where exactly in the head the pain is?
Well, I start noticing it 2 weeks ago, like about 4 weeks ago, and
Hmm.
it will come like shooting pain coming around my eye, sometimes around my face side cheek, and
Hmm.
then it becoming more frequent now.
Hmm.
Yeah, it
Okay.
won't stay a lot. It's just a few seconds, maximum 1 or 2 minutes, and then it will go. But because it's becoming more frequent, it's affecting my concentration in work, and so I'm not sure what to do.
Okay. Okay. So, and I can see from your records that you had migraine before. So, this headache, which started about 4 weeks ago, is it similar to that previous migraine attacks, or is it different?
Well, doctor, I'm not sure is it migraine or not. Is this just the
Hmm.
dentist told me it's migraine, so I'm not sure. I didn't have migraine. I didn't have any headaches from before. This is my first time to experience such headache.
Okay. So, previously you
Yes.
never had this sort of pain.
No, no, and I'm not diagnosed as I never diagnosed as having migraine. So it's just, I'm not sure. Is it migraine? And this is what the dentist told me, so I'm not sure.
Okay. Apologies. I think I misinterpret the record, but that's fine. We'll talk about that and we would be able to find out whether you have got migraine or not. Is that all
Sure,
right?
sure. Yeah, yeah, sure,
Okay.
sure.
So you mentioned that the pain starts around the eye, goes around the cheek, and it's a sharp stabbing pain which
Yeah,
lasts for a few seconds.
yes, yes.
Okay. And along with that, have you noticed any watering of the eyes?
No, no.
Okay. And where along the cheek the pain goes?
Sorry.
Where on the face the pain goes?
Well, it's taking all all this area. So
Hmm.
sometimes going down a little bit, sometimes going up, and sometimes taking all this half of the face. So I'm not sure, doctor, and it's not always the same, but I
Hmm.
notice it's like it's very sharp. Like someone is stabbing my face, sometimes up, sometimes down, sometimes taking
Hmm.
all of it. So yeah.
Okay. And have you noticed any numbness or tingling sensations over there?
No, no, doctor.
And in between you get the pain attacks, are you having any symptoms or you totally feel fine?
No, I'm totally fine in between, which is weird. Yeah, I'm totally okay. Yeah.
Hmm. Okay.
So even
And
I'm not sure to take painkillers or not because
hmm,
I'm not in severe agony every now and then, but when it's come, it make me really I can't concentrate in work. I try to take, to be honest, some paracetamol
hmm.
and some cocodamol, but I there is no difference. I didn't see any difference there.
Okay, sure. We'll talk about that as well. And you mentioned that it's on the right side of the face. Does the pain go on the head as well?
Where exactly in the head? It's coming to my forehead. Yeah, but is this what you mean? This
Yeah.
area? Yeah, in the front of my head. Yeah, but where else you want to ask, doctor? I mean, where
That's
do you?
fine. What about, have you noticed any rash?
Rash? No, 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 no rash.
Any nausea or vomiting associated with this pain?
No, no. But
Okay.
yeah,
Any speech problem, have you noticed?
no.
Okay. And any weakness of any limbs?
Limbs? You mean my arm or legs? No, no.
Exactly. Exactly. That's what I mean.
Okay. No,
Okay.
doctor, no.
Okay. And just a
But
lifestyle
does
question.
does it is it related, doctor? My arms and legs to the headache?
Sometimes it can be. Okay. But in your
Yeah.
case, it doesn't look like.
Okay. Thank you, doctor.
Okay. So, just a lifestyle questions, because if we suggest any changes, it should be incorporated to that. So, am I right to ask, do you smoke?
No.
Do you drink alcohol?
Well, occasionally, doctor.
Okay. And how is this pain impacting you? I know that you're quite stressful about it, but how is it impacting your work or your day-to-day life?
Yeah, yeah, doctor. To be honest, I'm working in IT, so when I'm most of my work in front of the computer, and once it come, I can't work. And now
Hmm.
because it's coming more frequent, maybe every an hour, so
Hmm.
I need to cut off my work. So and
Hmm.
my boss saw that, and they start to notice that in more in the office, and they start to talk. So
Hmm. Okay. Okay. Sure. And yeah. So, uh, uh, thank you very much for sharing all this information with me. So, should we talk about that? What I suspect and how to support you best?
yeah, sure, doctor.
Okay, so you thought that it is the migraine, but based on the fact that it comes in as a sharp stabbing pain, lasts for only few seconds, and it is typically in the area around the eye and on the face. I suspect this is something called as trigeminal neuralgia.
Okay, and what is that?
So yes, so basically, our face is supplied by a nerve on that side of the face which you are describing. It is called as trigeminal nerve. Okay,
Okay,
and if this nerve gets irritated for any reason, and you get this pain, this is called as trigeminal neuralgia.
okay,
Okay, so at the moment, I'm not sure what's the particular trigger for that. So, and sometimes we are not able to find any trigger as well. But would it be all right for you to come for a face-to-face examination?
yeah, and what you want to examine, doctor?
So I would have a detailed examination of the nerves on your face. I will feel the sensation and I will check the nerves in the rest of your body, and I will take your numbers as well. And based on the findings, I would be more reassured if that is a similar kind of pain.
Okay, okay. So if it's not, what are you telling, trigeminal neuralgia, or what might be the cause of irritation of that nerve? Because you said sometimes no cause, sometimes some cause. So it can be cancer then, doctors, as I read.
Very, very unlikely. But doing a nerve examination and making sure that we are not missing any of the signs and symptoms of the cancer would be reassuring. The
Okay,
other possible causes is that if the nerve get irritated by anything, sometimes a viral infection can give the irritation. Sometimes, yeah, the blockage of the sinuses on the face can give you similar symptoms. So, and most of the times we don't even know the cause.
okay. So blockage in my sinuses can irritate the nerve.
sometimes it's a possible cause, but before we are assured that this is the condition, I know that you have got a lot of questions, and I'm
Uh-huh.
very happy to send you a leaflet for to read more about that, if it helps with the things, and when I see you face to face we can talk about the things more.
Okay, sure, sure, doctor. And so if it's this trigeminal algia or neuralgia, what I was saying, are you what you will give me to treat?
Okay, so yeah, first of all, I would speak to my colleagues in the hospital under the specialist team, and then I would suggest you prescribing a tablet called as carbamazepine.
Okay, okay. And is there is any side effect of that, and for how long I will take it, doctor?
Okay, so yes, there could be a potential side effect of having this tablet, and sometimes it can give you a tummy upset, and sometimes people, get low blood count because of this tablet. But we will keep an eye on that. And I mean, initially, let's start the tablet for about 4 weeks, and then we will see the response, and I will speak to my colleagues in the hospital to find out that how long you need to take it.
Sure, sure, doctor. So do I need any imaging to see my brain if there's tumor or not? And do I need blood? Do you want to take
Uh,
some blood for me, doctor?
so if you feel any numbness around the area, if there are any signs of weakness, if any hearing difficulties, or if any weight loss or any weakness of the limbs, then we usually proceed for the imaging. Otherwise, we can decide the things on the base of examination.
Okay, thank you. Thank you. How did you
Thanks.
feel?
It didn't go very well. First of all, I
No,
missed
you
the,
did a lot
you
of
know,
you know
the
you did you,
migraine thing.
no no you did no no you did a good job. Okay, but so in reflection to what you did, would you do anything differently? So let us
Exactly.
know.
I will
Yeah.
do a lot of
So
group.
so
So
say
yeah, I mean, I was more towards asking the open question. I think I would try to finish the job with my close question first, and then talk about rest of the things. I didn't ask a lot of question about weight loss, early morning headaches, and nausea and vomiting associated with that, and didn't work on too much on the differential because the diagnosis was too clear. And I didn't ask for the trigger. Sometimes touch, like shaving, or
yes
this can be a trigger. I didn't ask
yes
about the hearing loss, or on the thing, because I thought that probably I would say it on the management.
yes
So coming to the management, there is a chance that I can straight away say that I will send you to the neurology, and that will take all the burden from me. But if there are the indications that there is no associated thinking about the brain tumor, and in between the taxi is fine, and there is no numbness on the area, and on examination I couldn't find anything, then I think I can start the things on the in the primary care, and I can see the response. But I mean, that's what I practically do, but I'm not sure. I haven't read the nice guidelines about it, and that was confusing for me.
okay, sure, sure, sure. Yeah. Well, don't be harsh on yourself. You did fine. Okay. So it's just maybe we can take it from the start, and I will tell you maybe where was the confusion is. So that's why I told you please try to look at the information that they give you. Okay. So if you can
Hmm.
see, so it's this patient was not diagnosed as a migrainous patient, isn't it? So the complaint is migraine, and this is very common, isn't it? The patient will come with a headache, and we tell, oh, I have migraine, because most probably this is what the patient is hearing in the news. Headache and migraine are very connected. So when the
Hmm.
patient is coming with migraine, please, even in your real, an exam or real life, double check is he was diagnosed or she diagnosed as a migraine or not. Okay. And then
Hmm.
from there you will take it off. So I think this was the main confusion, that you thought she is already diagnosed as migraine. This is what I
Exactly.
get, isn't it? Yeah.
Hmm.
So and I think that how you would come over that is how you started your opening. So yeah, I did like that you used the name of the pre-existing information, which is the name, that you
Mm.
call the patient by his name, and this is very good. This will break the ice between you and the patient. So I my personally don't like that when someone calling me will tell me, oh, I am say I am Salim, who I'm speaking with. Well, you called me, yeah. So if you are calling me, you should know my name. So
Mm.
I would like always in the beginning, yeah, hello, I'm Dr. Salim, for example. May I speak with Adam Apple? Okay, rather than hello, I'm Dr. Salim. Can I confirm your name and date of birth, so it's big difference between the two, two ways. Okay, so breaking the ice is very important, and you did that, but then you didn't use the rest of the information that you already given, with the
Mm.
patients complaining from migraine. So, okay, Mr. Adam Apple, I can see from their notes you are complaining of migraine, and that's why you came to see me today. Is there anything else, or I'm getting
Mm.
the information right or not? And then let him speak. Okay,
Mm.
then he'll tell you, yeah, doctor, yes, well, yeah, I went to that dentist and the dentist told me it's most probably pain. Okay,
Mm.
and then when you ask your kid, it still didn't appear in our exams. Okay, that tell me more. Okay, so when usually in other exam, if you tell the patient tell me more, you started with this open question, then he will answer you with a closed question like I did. So what you
Okay.
want to know? So
Mm.
do you know what is the difference between open and closed question?
Yeah. But
Okay.
I get really confused when people say, "What do you want to know?" And I feel like that I have asked something wrong.
No, no, it's just he's instructed to drag you to close the question. That's only, which is, it's not preferred in our exam. You need to keep your first or second, at least two, three question to be open, and then you can start to do the closed question. I think and this were the area you started to lose the control of your
Mm.
consultation. Okay, so if the
Mm.
patient told you what you want to know, so, okay, he closed it. Then ask him again, open question. Don't close it. Because you
Okay.
would, okay, so when it started, then he will give you the information piece by piece, and this
Mm.
will lose your time. Okay, ten
Mm.
second here, 10 second there. So you will tell him when it started, where it started, how it started, then, he will keep losing your 10 second, 10 second, 10 second, and at the end, you will find your management plan will not start at 6 minutes.
Mm.
Okay, so if he tried to close the question, then tell him, okay, take me through the story from the beginning. How
Okay.
it is, yeah, take me through the story from the beginning up till now. So you be more clever than him, okay? So
Mm.
he will start to talk. Okay, yeah, I have this sharp pain. It started 4 months ago, and then I went to the dentist yesterday or the day before. He examined my, and here also he give you another clue in your differential. Okay,
Mm.
he already removed the burden of asking about the teeth problem or the
Mm.
TMJ problem, because this one of your differential of unilateral facial pain.
Mm.
Okay, so he already exclude that. So then you can reply, oh, great. Then he did examine your mouth. He did examine your teeth. Did he examine the joint in your mouth here? He will tell you yes. Okay, then most probably this are not the causes. So let me ask you a few more questions to understand what might be the cause.
Mm.
Okay, and then proceed in your questions. I personally like if you have multiple differential, you
Mm.
nominate the differential with the questions, and
Mm.
that will save you time in the management. I know there is no massive time for you to change your way of consultation,
Mm.
okay? But if you can, or if you find it helpful, more helpful for you, you may use this way, okay? So, well,
Mm.
sometimes if you have problem with your sinuses, with your nose,
Mm.
can give us such pain. Do you notice any blockage in your nose? Do you have any runny nose? No, then
Mm.
you finish that. Do you finish the nasal issues? Okay, you finish the nasal problem. Okay, did you have any problem at your ears? Your hearing is fine. Okay, then most probably there is no problem with your ear. Do you have any problem with your vision? No, no. If there is any pain when you are moving your eyes? Okay, no problem. Okay, then the nerves of your eyes is most probably fine. So you are excluding the things. Then you are saying, then using his eyes, he told you, oh, maybe it's cancer. Okay, he did mention that very early in the consultation. So then even when you are asking, you can exclude that. So because you are thinking that it might be a cancer, or you read that might be a cancer, do you have any nausea or vomiting? Do you have any weakness at your hands, or numbness at your hands and legs? Or don't say limbs, please.
Mm,
Hands and legs. No, I don't have. Okay, that's very good. That's reassuring. So most probably there is no cancer there. And then
mm,
proceed, and then already you are ticking the boxes that you will do in the management. You're already
mm,
ticking the boxes as well in your differential diagnosis. So nominating of your differential diagnosis in the man in the first half of the consultation will save you a lot of time in the management. Okay.
mm. Okay.
The other thing that it's important in such case to ask about is the family history, isn't
Mm,
it?
mm.
Yes or no?
I can't
Yes or no, and why?
recall.
If anyone in the group wanted to participate, so is family history here important or not?
I think family is too important because multiple sclerosis sometimes could
Exactly.
present it.
Yes, MS. So this one of the
Yeah.
differential. Okay. So you need to ask, well, did you hear about MS from before? No, what's that, doctor? Okay. So most probably it's not running in your family, so don't bother. But it may be one of the causes, but since you don't know about it, so most probably is not the cause. And then in the management, I like still the psychosocial and the eyes. Yeah, the ice, yeah, it's good. Yeah, sometimes ice can be used as a technique of triggering what the patient is thinking of, but using it in the beginning of the consultation can sometimes appears that it's formulaic. So
Mm,
usually when I like to use ice in the beginning of the consultation, if you have a complaint that doesn't have a differential diagnosis,
mm,
or if the patient coming with a complaint that you don't know what you should do about it, or multiple complaints, then you cannot gather what he wants exactly. So
mm,
then using the ice in the beginning will help you, will guide you, and most probably the patient will be instructed to say the ice in the beginning. But
mm,
using the ice in the beginning can make the things to be a little bit clunky. Okay.
mm.
So just take care from using the
Okay.
ice in the beginning. Okay.
Yeah.
Except, as I told you, if you don't have a clue, and this is, headache. So headache, most probably you will have a lot of clues there. So
Mm,
don't use that with the patient having headache. Okay, use it with
okay.
patient, middle-aged lady coming with, multiple complaint that you cannot connect it to each other. Then you may ask her. So, well, okay, we'll definitely will ask. We will discuss what. Don't say chat, please. Say discuss. Okay, because chat is informal. So definitely we will discuss what might be going on. But did you have any thoughts by yourself? Did you Google it and then see what she will tell
Mm,
you, and this will give
mm.
you a clue how you will go in the next step. Okay.
Okay.
Then you in the psychosocial, I felt that you have cliche statements. Can you repeat it? What you said, just to ask you a few questions about the lifestyle, because lifestyle can affect your complaint, isn't it? Yeah? This is
And
what
I
you
said
say.
that because if we suggest some changes in your
Okay.
routine, it would be
Okay.
better to know.
Yeah, it's good, good sentences. But if someone malignant will say, okay, so this doctor is using with every consultation the same statement, which he might
Mm,
consider it like defect. He might, some people will think like that. But you can just, okay, you told me you are an IT technician or IT whatever engineer. So sometimes if we have some stresses at work that might trigger such headache. Do you have any
mm,
stress at work? No, doctor. No, no, I don't have any stress as headache. So, okay, some people will find this headache may be triggered by, alcohol drinking. Do you drink alcohol? Well, no, doctor. Well, yes, doctor, occasionally. So, if the patient told you I'm drinking occasionally, what does occasionally mean? This is very
mm,
important because it's non-specific term, isn't it?
mm,
Same as when the patient tell you, okay, I'm drinking socially. What does socially means for the patient? Well, this is different from patient to patient, isn't it? So you need
mm,
again to explore that. So yeah, well. you said occasionally, so just because it's the occasion is different from patient to patient, would you just tell me what occasionally mean for you and then explore that more? Maybe he is drinking every other day, which is occasionally for him.
Hmm. But
Okay.
in this case, if it's not, if the disease is not, in my mind, if it's not being affected by drinking alcohol, do I need to explore that much?
Well, I think headache is would be related to alcohol as well. So, well, the alcohol can make vitamin B12 deficiency and can cause demyelinating disease, isn't it? So,
Hmm.
neurological symptoms will be related to alcohol. So, it's related. Maybe smoking, maybe yes, maybe no. Except if
Hmm.
he's trying to cut off smoking and you have
Hmm.
nicotine withdrawal symptoms, then it will be related. But I think a headache in general will be a psychosocial, would be most probably, all the aspect of the psychosocial will be related: smoking, alcohol, exercise, work.
Hmm.
It is, I think it will be related, okay, because
Okay.
exercise might be related if he's weightlifter and he
Hmm.
is going to the gym and he makes sprain to his one of his muscles, and the muscle, that might be related to his headache and his, unilateral facial pain, isn't it?
Okay.
So yeah, and then what
Okay.
I like, yeah, I like the your strategy in putting a line. We draw the line. So you draw the line to the examiner, to the patient. Yeah, I finished now my data gathering. I finished my first half of the consultation, and I'm going to the second half. And you said, okay, now we will discuss how we can help you and what might be going on. So I like the way you draw the line. It was a clear cut, but the clear cut was in 4 minutes and 14 seconds, which little
Hmm.
bit late. Okay.
Hmm.
But you did get the you did get the diagnosis, and this is important. Okay. So what we need to know that trigeminal neuralgia, if it's primary trigeminal neuralgia, you can treat it as a GP. You don't need to ask the neurologist to treat it or what you want to write for it. If you are, clinically, clinically confident that this is a primary trigeminal neuralgia, you can just, start the treatment.
Hmm.
And well done for you to bring the patient in, because you need to examine this patient. You cannot
Hmm.
diagnose it over the phone. Yeah, you need to examine him. This is a safety. I can see this is a safe consultation. Okay. So by bringing the patient in, necessarily, it's not unnecessary bringing him in. And you did justify that by the examination. But what I would like to hear from you, that when you said that if there is no specific cause, guaranteed from us to call the specialist, I would start for you a tablet called carbamazepine, and then when you are prescribing, to take the full mark for the prescribing, then you need to tell what are you prescribing, how much you are prescribing, okay, and how often, what is the possible side effect, and when you will stop the treatment. Is it forever treatment, or is just for a year or for a month? So this
Hmm.
is something that you need to. Well, usually carbamazepine, the starting dose is 100 milligram, okay, once a day, and then you will up titrate it up to 1.6 grams, okay, a day, which is very unlikely to reach in trigeminal neuralgia, such high dose. But before starting the carbamazepine, you need to have a baseline liver function and full blood count, and then safety netting about sore throat, fever, because it can decrease your immunity a little bit,
Hmm.
decrease the number of your white blood cells, and then this will make you maybe more prone to infection. However, a lot of patients, I know that they are on the medication, so put a little bit of confidence with the patient that you are happy to prescribe this medication. But if you are hesitated, and then, oh, I will go and ask the neurologist, the patient will be little bit afraid. So you put yourself in the situation of, in the place of the patient. If he feel that you are not confident, most probably he will refuse to take the medication, isn't
Hmm.
it?
Hmm.
Yeah, so yeah, it can make him drowsy as well a little bit. So safety netting about driving is important.
Hmm.
And then I start to just hit you with the question, okay, is it a cancer? Because I didn't hear that is, I didn't hear that is definitely most probably not a cancer from you. That's why I told you about the imaging.
Mm,
And the blood test, just because I want just to tease you and see how if you know the information that you need to do the liver function and
mm,
the full blood count. You did know that granulocytosis is one of the completion of the carbamazepine,
mm,
but I would like to hear that you would do full blood count at least for me.
mm.
Okay.
Yeah.
Um Besides, it's not wrong if you're a little bit suspicious from his examination, you would do some full ESR or CRP just to exclude other things. And when you was asking about the differential, you did say, "Oh, there's any pain in any other part of your face." I did understand that it maybe you're asking about temporal arthritis,
Mm,
isn't it?
mm,
But be specific when you're asking about temporal arthritis. Either
mm,
you will say yeah, because sometimes there is, if you have inflammation in the arteries supplying the side of your head, that can give you a pain. There is any pain at the side of your head, and you have the privilege that the patient is seeing you, so you can point it out, or
mm,
you just ask him when you are combing your hair, do you have any pain in that? Do you have any pain in your scalp? Because the scalp is something and face is another thing. It's not
mm,
one part, okay? Yeah, so head is something. Head
mm,
contain all the scalp and the face and the occiput, but the scalp is different than the face. Okay, so don't mix both of them. If you ask the patient about his face, he will not tell you about his scalp. I did know that this is what you intend to ask, but the
mm.
patient will not
It
know.
was not clear.
Okay, yeah, so face for him is a face,
Mm.
scalp is another part of your head. Okay,
Yeah, I hear that. Yes,
I hope that was clear.
it was very
And
helpful.
yeah,
Thank you.
if
Yeah.
anyone else have any question regarding this case, silence mean either you all satisfied or you are all not satisfied. I'm not
Can I
sure.
please ask how long he needs to continue the
I think, yeah,
treatment?
we don't have a
Yeah,
question. Yeah, it was
yeah,
good.
Okay.
You
yeah.
explained.
So no, that's a good question. For how long? So most probably will continue until the pain stop. Okay, because you need to control the pain
Mm,
and reach a stationary control of the pain, okay, which is usually you will stay on the tablet for 1 month, okay,
mm,
with a stationary level of pain control, okay.
mm,
So say you control the pain and 300 milligram of carbamazepine, so you will stay on the 300 for a month, and then after that you will gradually withdraw the carbamazepine until the lowest possible dose or until you stop it, okay.
okay.
Yeah, I did a PowerPoint, okay, that I would share with you all. So about possible differential of unilateral facial pain, okay, and about the trigeminal neuralgia. So you will not waste your time and just read that. I think it's more than sufficient, okay, especially the people that have their exam next week, okay. I don't think I need to add anything from what we said, just to double check. They will tell you the red flag and when to refer. Examination we discuss, and then uh, and here all most of the information regarding the carbamazepine. You are seeing that, yeah, guys? Yes, doctors, you are seeing this. You are seeing PowerPoint, yes, or not?
Yes,
Yes, yeah, we can
yes.
see.
Yes, okay. So I hear you will find most of the information about, okay, the carbamazepine, and then just a little bit of differential about the headaches. Okay, so you can just gather your thoughts rapidly about the probable differentials, especially if a case coming with headache, because it's the common thing that you are using it. You are seeing headache maybe one or twice a day, so it is always a probable, exam question. Okay. Shall we go to the next? Oh, sorry. Shall we go to the next case? Are you happy, guys? Shall we go to the next case?
Yeah.
Yeah. Okay. So, uh, Rizwana.
Yes.
Yeah. Let's see that. Shall I start the 3 minutes? I
Yeah.
think there's still, yeah, there's still of, yeah. So it's like that. So when you read the first bit, just tell me to go a little bit down because I think there's only one line you will not be able to
Okay.
see. Okay?
Okay. Yeah. Sure.
Yeah. Let's start the 3 minutes.
Can I see the last line?
Yeah, sure.
Thank you.
Okay. Just
Hi,
before
Sarah.
going, yeah, 1 minute, 1 minute. Just I
Yeah.
want to double check if the recording is going on or not. Just 1 minute. Okay.
Okay.
I'm so sorry for that. Recording, yeah, recording is going on. Yes, come on. Yes, okay. Shall we start? Yeah, we'll put the
Yeah.
12
Yeah.
minute
Sure.
timer. Yeah.
Hi, Sarah. I'm Rizwana, one of the doctors from GP Surgery. Could you please
Yes,
confirm your date of birth?
yeah, I'm 45 years. Thank you. Thank you for calling, doctor. Thank you. Yeah.
Okay. How can I help you today? I could
Well,
see from your records our today's consultation to discuss some metallic taste.
yeah,
Am I
exactly,
right?
doctor. Yeah, absolutely right. Thank you very much. Yeah,
Mhm,
yeah, to be honest, doctor, I'm not sure, this have
mhm.
been now for about, maybe a few months now. I have this taste, I feel that's like metallic taste, strange taste
Mhm,
that is
mhm.
becoming more frequent now. I don't know what
Okay.
to do. Or even I thought maybe
Mm,
I'm, not washing my teeth properly or there's any problem with my oral health. Then I went to dentist, and you know how it's a pain to find a dentist nowadays. But then I went there, he just had a look at my tooth and he told me everything is fine. Yeah, he
mhm.
told me go to your doctor. Most probably you have hormonal issue. So I said, okay. Yeah, he's telling me I'm
Okay.
menopausal now. So I feel offended.
Okay.
He's very rude. So
Mm,
I'm not sure, doctor, what,
okay.
yeah.
Mm. Sarah, thank you so much for sharing all those information. You gave me quite valuable information. So you said your metallic taste in the mouth going on for a few months. It's really good that you checked all the dental issues, and from that point of view, you were fine, and you were thinking about hormonal issues. Um, can you tell me a bit more about how are you feeling?
Well, I'm generally, well, I don't know, doctor, really. I'm a little bit worried
Mm-hmm,
about my health, So
mm-hmm,
since 2 months ago, I think, I'm not sure if
mm-hmm,
this is written in your notes or not. I have
mm-hmm,
this cough, and then the
mm-hmm,
doctor saw me, and then they changed my blood pressure tablets, and then
mm-hmm,
the cough little bit improve, little bit not. Sometimes there, sometimes not. I don't feel
mm-hmm.
much improvement on it, to be honest. And then
Okay.
yeah, and then suddenly I had this, hoarseness of voice,
Mm-hmm,
uh, runny nose, and blocked nose.
mm-hmm,
I don't know, and that is
mm-hmm,
never going. I use all the nasal drops over the
mm-hmm.
counter from Boots, and then I think they
Okay.
become they
Mm-hmm,
become very rich because of me.
mm-hmm,
And then nothing is
mm-hmm,
useful. And then when I came to your colleague, and then he just
mm-hmm.
dismissed it. He told me, "Oh, this
Yes.
is just a simple viral infection, and you just go and
Mm-hmm,
to and I don't know. I don't know
mm-hmm.
really. I don't know,
I'm
doctor,
really
really.
sorry, Sarah, that you are feeling that way. Definitely, we could discuss together to come into the bottom. Okay.
Sure, sure.
Okay. So you told me that your cough is slightly better, but it's still there.
Yeah.
So are you taking the new medication, blood pressure medication, always certain?
Yeah, I'm taking it. Yeah, I'm taking it.
Good. Good. Your blood pressure is well controlled now?
Yeah, I think so. Yeah, I have this blood pressure
Okay.
machine, and it's always below
Mhm.
130 over 80, so I
Oh,
think it's
that's wonderful.
controlled.
Okay. Your harshness of voice, is it still there?
Well, the hoarseness not, but
Mhm,
sometimes. So I
mhm,
noticed something weird, to be honest, doctor.
mhm,
I bring this. There is a pillow that I bring it from Amazon. Okay,
mhm,
okay, to raise my
mhm,
head a little bit, because
mhm,
and then I said maybe I'm snoring because then I'm when
mhm,
I'm lying flat, and this is maybe affecting
mhm,
my
mhm,
voice. But
mhm.
then when I raise the head of the bed little bit, yeah, the hoarseness gone. Yeah.
Okay, okay, that's quite good. So I'm just trying to figure it out in case if you have any indigestion problem. Do you feel any burning sensation on the chest or
No,
on
no,
the upper
I
tummy?
don't. No, no, I don't have any indigestion symptom. Yeah, I know what you are saying. That
Hmm.
the what is
Okay,
the they're telling me
okay.
reflux,
Hmm.
isn't it? This is what you're asking
Yes,
about.
absolutely,
Yeah, reflux.
absolutely.
No, no, I
Mhm,
don't feel the same. But surprisingly,
mhm,
when I use this
mhm,
pillow.
mhm.
I don't feel any of this reflux symptoms since I use it. And
Okay,
then,
okay.
and even doctor, yeah, you did ask about the tablet of the blood pressure, but there is
Mhm,
another tablet they are prescribing to me, and I stopped taking
mhm.
it because really I don't think that
Okay.
I need it. So the
Mhm.
reflux
And-
symptoms are gone.
Okay. Any particular reason that you stopped taking lansoprazole?
Yeah, because I don't have
Because your
any
symptoms improved.
burn.
That's why.
Yeah, because the burning
Okay.
sensation
Mhm.
and all of this
It's gone.
gone,
Okay.
but the cough is
Mhm.
still a little bit there. Is it
Okay.
related?
Okay.
Could be related. I don't
Uh,
think so, doctor. Yeah. Then yeah. Go ahead,
I'm
doctor.
just trying to jot everything together. Okay. So
Mhm.
few quick questions I need to ask you. Do you
Yeah,
feel
sure.
any acidic sensation going up to your throat?
Acidic? No, no, doctor. I told you my
No.
reflux symptoms gone. It's
Mm-hmm.
just this the
Okay.
taste, the metallic taste, and it's
Mm-hmm.
always more in the morning.
Mm-hmm. Okay. Okay. In the morning. Okay. Have you noticed any unintentional weight loss?
No, no, doctor.
Any fever?
No,
Any night sweating?
no,
Okay, that's quite reassuring. How is your bowel habit? Have you noticed any change at all?
no. My bowel is fine.
Okay. Um, did you notice anything going down at the back of the throat which make you cough?
I'm not getting what you mean.
Sometimes some mucousy things going down at the back of the throat which make people cough. Do you feel that?
Oh, I got you, got you. I mean, if there's some dribble down in the back. No, no, I
Yes.
don't. Yeah, no,
Yeah.
no, no, I don't have
Mm-hmm.
any
Mm-hmm.
dribbling. Yeah, I thought about, the dribbling to the back. I read that in the Google, but
Mm-hmm.
no, no, I don't have
Mm-hmm.
that.
Okay. Some lifestyle questions could be associated with that. Have you ever smoked?
Well, yeah, when I was teenager, no, I smoked when I was maybe 16, 17, but I stopped now.
Mm-hmm. Okay. How about drinking alcohol? Do you drink alcohol?
Well, socially, doctor.
Okay. Can you explain me a bit more? What do you mean by saying socially?
Okay, though, doctor, I'm working in the bar in the restaurant.
Mm-hmm.
So yeah, whenever anyone cheered me with a cup of wine or something, I would drink. Yeah.
Mm-hmm. Okay. How many days in a week do you usually drink?
Well, every day, to be honest, doctor. Well, I'm working
Mm-hmm.
5 days a week, and
Okay.
then over the
Okay.
weekend,
Mm-hmm.
I share a
Mm-hmm.
bottle of wine with my
Mm-hmm.
boyfriend. So yeah.
Okay. Can you give me a rough idea in a day how much do you usually drink? Or in units, if you could tell me?
Well, God knows, doctor. I don't know. God knows.
Mm-hmm. Okay, okay. About your diet, any fatty food or oily food at all?
No, no, I'm trying to eat healthy. No, I'm not
Oh,
eating.
that's very
Yeah.
good. That's very
Yeah,
good.
although I'm not
Uh,
losing weight, my weight is,
mhm,
I think maybe in the higher
okay.
side, little bit,
Mm-hmm,
but I'm not
mm-hmm.
eating
Sometimes,
much.
okay. When you said you are not eating much, is it low appetite or you are trying to like be cautious, be healthy?
No, just because I'm finishing very late and coming,
Okay.
I'm sleeping. I
Mm,
don't have time to
mm-hmm,
cook, so
mm-hmm.
so I'm not
Oh,
eating much. But usually I'm eating fast.
mm,
I'm eating microwave food, so but
mm.
not much. Maybe I'm eating once, to be
Okay.
honest. Yeah.
Okay. Any stress or anything going on, probably like personal life or at work? How do you feel?
No, no, I'm not stressed. I'm feeling a happy life. I'm only just stressed because I can't get rid of this taste, metallic taste
Mm-hmm.
that I'm not
Mm, I could
enjoying
imagine.
my and
Okay.
your colleague, this dentist told me that I'm becoming
Mm-hmm.
menopause or then
Mm-hmm.
told me
Mm-hmm.
hormonal problem there.
Mm-hmm.
Really, I feel
Okay.
sorry that I went to him.
Oh, let's see. Like you said, hormonal issues is one thing in your mind. Anything particularly that I could do other than addressing your concerns today?
No, doctor, just to get rid of the metallic
Okay.
taste.
Okay. So, after talking to you, I'm thinking about your symptoms could be related to reflux symptoms. Though you
Could
told me
be.
that you are not, yeah, I could see it comes like a surprise
But I
to
don't have
you.
symptoms, doctor. Yeah, I don't have this
Mm,
burning thingy.
yeah.
I don't have
Mm-hmm.
are
Mm-hmm.
you sure,
Mm-hmm.
doctor? Hmm.
The reason, Sarah, I'm thinking about reflux symptoms, you told me that your diet, because of your work pattern, it's a bit like a irregular diet pattern, and the
Mhm.
drinking habit. These two things making me think about probably reflux symptoms we need to address. One more thing I want to tell you quickly. You told me a few times about hormonal issues. I think I won't be able to cover it today, but I
Okay.
will book a separate appointment so that we are talking in details about the hormonal issues. But today, is it okay if we be strict on how we can manage your metallic taste? Is that okay?
Yeah, yeah, sure. But I still not convinced, to be honest, doctor. But however,
Mm.
you are the doctor.
Mhm. So, after talking to you, like I said, like drinking and this irregular pattern of diet could cause reflux syndrome. On top of that, you said this metallic taste going on for quite some time. So I
Okay.
could see my colleague has tried, as an example, your dry cough has subsided after changing the medication. So cough, a bit of longer dry cough could be associated with reflux symptoms as well. Okay.
Uh-huh. Okay.
Mm-hmm.
Okay. So it's not just feeling this burning, this burning heaves. That's all, so it's not.
Absolutely right. So indigestion symptoms could represent in a different way. Also, I'm thinking you told me there's some runny nose and this sensation going on as well. But you make me a bit reassured when you said nothing going down at the back of your throat. So I ruled out some other causes of your metallic taste in the mouth. Is that
Okay. Yeah,
okay?
yeah, yeah.
So,
Okay.
so how do you feel going back to your lansoprazole? and cutting down your alcohol. Do you think you will be able to manage something in terms of your drinking alcohol?
Well, doctor,
Because
if you
that's
feel
so
that
important.
if you feel that this is the cause, that one of the
Mhm,
causes, yeah, why not? I will
mhm.
try. Sure, yeah, yeah. What
Do you
else?
want any
Okay,
help?
and no, no,
Do you
no,
want
I'm
any
no,
help
no,
in
no,
terms of?
no, no. I'm
Mhm,
fine. No, I will
mhm.
stop it. It's just okay, and we'll start the. So, do you want me to start the tablet again?
Yeah, so if you start your lansoprazole again, and I would like to review in regards to your reflux symptoms in a month time, how are you doing? Please don't stop, like when you are trying to reduce drinking alcohol, reduce it gradually rather than stopping suddenly. Is that okay for you?
Yeah, yeah. Don't worry about the alcohol. I will deal with it. But
Mhm.
then the
And
tablet, and there's anything else we will do. Yeah.
sorry, I
How
was a
do you
bit of
feel?
all over the place.
No,
I
no, no,
reached
no,
management
no.
so late because I could not figure it out what it is exactly. I was thinking about postnasal dribbling and then
Mhm.
like if any red flag and all those I got
No,
messed up.
that's good. I mean, so reflecting back about what you did, what you may done, what you may done differently.
Definitely one thing like time management is so important.
Hmm.
I don't know, probably the way I formulate the questions. I don't know. Like
No,
definitely
I
I
will
need
tell
to.
you. I will, yeah, I will, no, I will
Yeah,
tell you. I will
definitely.
tell you.
Yeah,
Yeah, I will tell
please.
you. Then what else you wanted to change?
Mm, I'm not sure, Salim, honestly.
Okay, no problem. It's just I'm asking. I'm not trying to put you in the corner. Reflecting back on how you
Mhm.
perform is how you will learn. Okay,
Improve. Yeah.
so
Yeah.
the reflection is an important thing. Unfortunately, in our countries, they didn't teach us how to reflect about the
Mhm.
things, although
Yeah.
it's a part of our culture. Okay, so you
Mhm.
are always, before going to sleep, you are, okay, you should think what I did good, what I did bad in the day, isn't it, and improve
Mhm.
your,
Yeah.
the weight of the goodness and decrease the weight of the badness. This is the reflection, but unfortunately we are not using it in our practice in our countries. So you need to reflect in how you did with each patient, and
Mhm.
this is my advice. Even after you finish your CCT, you need to reflect on daily basis what I did right, what I did wrong, with every with the challenging cases later on, and that's how you will improve yourself. It's not only about the exam. It's
Mhm.
how you manage your the rest of your life. Okay, reflection
Yeah.
is how you become more mature. Okay, and how
Mhm.
your brain will later on will learn, and then will change the behavior. So to change your behavior, you need to reflect. If you didn't reflect, you will not change. So
Mhm.
I think you did in the beginning of the consultation, you did fine. You did use the pre-existing information, but not all of them, okay? Because the
Mhm.
trick is all in the patient notes. Okay, if you see the
Okay.
patient notes, you can see
Oh
that
yeah.
most of her symptoms is
Oh yes. Yeah.
extra GIT symptoms of reflux
Mhm.
and gastritis.
Mhm.
Okay, and I did volunteer about that. I
Mhm.
am not taking lansoprazole, and most probably, if
Mhm.
I didn't tell you that, you will not
Mhm.
you will not figure it out. So if
Mm.
I am a
Yeah.
mean
Yeah.
patient, I will not tell you. Okay, if you have medication in the patient lists, use and this medication might be related to his presentation, just to confirm the compliance. You might
Mhm.
have 10 medication in the patient list. You cannot check it one by one, okay, in the exam, otherwise it will, the time will go. But you may pick up the medication that is related to the patient's complaint. Okay, so metallic taste is one of the manifestation of reflux symptoms and
Mhm.
gastritis, isn't it? And
Yeah. Yeah.
rhinitis, hoarseness of voice, dry cough. They blame the ramiprazole for it, but then the ramipril for it. Then they change it, but still the cough is there. Okay,
Mhm.
yeah, when she used the olmesartan, the cough little bit decreased, but because she already buy the reflux pillow, okay,
Mhm.
and she is not feeling the symptoms of reflux, the typical symptom of reflux,
Mhm.
but simply there is something called micro reflux. So the patient will will not feel the, the GERD, will not feel the burning sensation, but still he may get the extra, the extra GIT manifestation of the reflux. I think if you did explain that to the patient at the end, even she will be convinced because she told you, I'm not convinced. And if the
Mm-hmm.
patient not convinced, this is a red flag
Mm-hmm.
for you that, no, the station will go out from me. I need to do something to let the patient convince. Okay.
Mm-hmm. Mm-hmm.
Then you did micro summarized in the beginning. I'm not sure why. Okay. Micro summary is good, but micro summary will consume your time.
Time,
And
yeah.
usually I'm not myself, I'm not using the micro summary except before the management plan if I
Mm-hmm.
need. So when I will need that, if I feel that I'm losing my nerve, okay, so micro
Mm-hmm.
summary will calm me down a little bit. The second thing, if I'm having quite sufficient time, I finish the data gathering in 7 minutes or something, yeah, I can do micro summarize, or 6 minutes. So the yes, micro summary will not take a lot of time from me. The third
Mm-hmm.
time, when I don't have, proper differential diagnosis, then I need at least just to relax a little bit and get this 10 seconds to gather my thoughts. Then I can then up, I can use the micro summary. But if you are running out of time, don't micro summarize, especially in the beginning. What you are micro summarizing? You are micro summarizing a little bit of the patient history, which I think killed a little bit of your time. Okay.
Sorry, I have a question. So in that case, shall I just could I tell the patient that in previous consultation you told my colleagues you don't have those red flag signs?
Yeah,
Any changes or anything to save
no,
my
no,
time? Or
you didn't micro summarize. You didn't micro summarize in the red flag. You did micro summarize in the beginning. So
yeah,
how
yeah,
you mean how to use the information that it's giving in this
yes,
case?
yeah,
Is that right?
yeah,
This is what I'm getting.
yes.
Okay.
That's what my
So yeah,
question.
you will say, okay, I can see that you are coming to complain, coming because of your metallic taste. Okay. And I
Mm-hmm.
saw as well that there is you have been quite regular the last few months. I can see that you are
Mm-hmm.
having a dry cough, and they change your tablet, and as well as you have some hoarseness of breath. How that been going on? How are you now?
Okay. Mm-hmm.
And then she will start to talk, okay? But then you
Okay.
you
Yeah.
you you used already the pre-existing information, okay?
Mm-hmm. Mm-hmm.
Without micro summarizing of what you micro summarize, as I
Mm-hmm.
remember, and you can double check that with the recording, that you
Mm-hmm.
micro summarize what she just told you. I have
Told me. Yeah. Yeah.
metallic taste. I went to the dentist, and the dentist
Mm-hmm.
told me it's maybe related to my hormones. Okay,
Mm-hmm.
so there at that time I think there was no need for micro summarizing. Okay, at all.
Yeah. Sure. I
Okay.
got your point. Yeah.
The other thing, I didn't hear a proper differential of the metallic taste. To be honest, yeah, you did say posterior nasal drip. You did say the reflux. But we did say hormonal thingy, but then what might be else?
I'm
You
like.
know, you may ask about over-the-counter medication. Is she thinking
Oh yes.
over-the-counter
Yeah. Over the counter
medication? Yeah,
medication. Yeah.
yeah. And you
That's
did
what I
ask
mean.
about the red flags, which was not. You said change in the bowel habits. You did say nausea and vomiting. I think so, but I didn't hear that, which is important at this case, any difficulty in swallowing, okay? That's important. Any lumps
Yes.
or bumps is important, okay? And I
Mm-hmm.
didn't hear you in after that in the manner you did say ice, but I don't know. I didn't hear concern, I think, or expectation. I didn't hear these. You did ask about ice indirectly. You said that, oh, you are worried about hormonal, but what about her concern? What about her expectation?
Okay.
Because she said, well, the dentist said that's hormone, then maybe her expectation
Mm-hmm.
is you to do blood tests for hormonal assay, isn't it? FSH, LH, and then they will then I didn't hear as well, you didn't ask her about her period. Is it her period regular or irregular? So these can be asked a little bit, in few words, and then you just tick it and go on. Okay.
Mm-hmm. Yeah.
Then in the management, you did ask about social, and that's important. Don't spend a lot of time if the patient told you, okay, okay. So if the patient told you, yeah, I will manage the alcohol, this is what all the
Mm-hmm.
examiner want to hear. Okay, yeah,
Mhm,
okay. You know that the alcohol is one of the things that you will target. You did explore what socially mean because this is a very important trick. Most of us would fail in it. Okay, you did explore that. Okay, so that's it. You may ask other things. You may say, okay, are you aware about that this? But I would be afraid that you might, lose the time. Okay, but
mhm,
if you find that there is, okay, were you aware that you are drinking more than, the recommended limit, the recommended, and you do the patient education, the recommended limit is 14 units per day with 2 to 3, days off alcohol. Oh, really? Okay, what is unit, doctor? Then you can explain a little bit of that, and then you may ask about, okay, because you are drinking, relatively large amount of units, do you drink only socially, truly, or because you are dependent on alcohol? Do you feel, if you stop drinking, do you feel shaky or tremory or confused, or when you wake up in the morning, do you feel hangover? Do you need to drink before, to function? So you may ask about these things if you have time. If you don't have time, just take it and go to the next question. Okay. I already know, as me listening to you, you know that she's drinking a lot, and you address it,
mhm.
and the patient already got the information, and she told you, I will deal with that. Okay. So
Okay.
she already
Yeah.
take it on her boat, okay, and in her
Mhm,
shoulder. If you have time, you may tell her, okay, we have this advice and guidance for, or this services to get rid of alcohol. But if you are short of time like now,
mhm.
don't spend a lot of time, because you did already, you
Yeah,
did
very
already
late.
the job. And then the other thing, you
Yeah.
missed the BMI. Okay, I would
Mhm.
rather to hear about the BMI more than that. You
BMI.
did ask
Okay,
about
okay.
her food. She's eating once, but once, she thinks if she eat less, then she's doing her, she's eating healthy. No, but that's not
Mhm.
right. She's eating ultra processed food. Microwave food is ultra processed food. This need to be addressed. Okay, and
Okay.
yeah, and correction of the patient understanding. Health belief is one of the main important points that a GP need to focus in. And for sure, the exam will test that, going on, going on, going on. How to correct the patient health belief, and understanding the patient health belief is one of the most important, one of the skills for the GP. Okay.
Yeah.
Uh, then when you are having a plan for something like gastritis or GERD, I would, me myself, like to hear what you will do now, what you will do in the future, and what we will do if the things went wrong. Okay, so what we will
Mhm,
do now, yeah, we will cut alcohol. We'll give you some lansoprazole. You will restart the lansoprazole. Perhaps you need to increase the dose of the lansoprazole, okay, because it's 15. You may give her the therapeutic dose, the higher the therapeutic dose with the 30 for a month.
mhm,
And then we will
mhm,
review that. If you didn't improve, despite that, you decrease your alcohol intake
mhm.
and you are committed to the tablets, then we might proceed to do H. pylori testing,
Yeah.
which then you will explain what's H. pylori. And if this negative, you explain what the test you will do. Usually we are doing the stool test for the antigen, okay? The urea breath test is not available normally in the GP practices, because you need to go and breathe in some, in the device, which is not available. So, and for sure the hospital will not call her for the urea breath test, except if the gastro will do it. Okay, so in the GP practice, you will do stool antigen, and
Mhm,
then you need to tell her then to stop the PPI 2 weeks before. You can't just tell it in a fast manner. Okay, we may do the H. pylori if you have time, then you tell her, then we will need to stop the PPI for 2 weeks and then do this test. If the H. pylori is positive, we will treat it and then reassess. If it's negative, then we might consider doing a camera test and looking at your, your stomach, isn't it?
yeah.
And we may do also, checking the pressure of your sphincter down below, the lower esophageal sphincter. Yes.
Mhm,
So the sphincter at your foot bite, we may also, it can be done at the same sitting. The gastroscopy, and then the manometry for the for the lower esophageal sphincter. So these things, if a case of GERD or gastritis, I would be eager to hear that the doctor in front of me know these steps. Okay,
Mhm. Yeah, sure.
is it clear? Anything you
Yeah.
want to ask about? Anything
No,
the
I'm just
people
thinking
around
like
me? Yeah.
I'm trying to reflect myself. So probably to make my life easy, I could say like this acid reflux I'm thinking, and then I would like to discuss today about drinking, about diet,
Yeah,
about
yeah,
BMI.
exactly. Yeah, you can
So
if you feel
these
that the
things
time, yeah,
related,
you,
yeah,
yeah,
and then
exactly. If you
discuss one by
can,
one.
yeah, if you
Yeah.
can, yeah,
Mm.
if you feel that the time is running out of you,
Yeah.
you may just put a headings. So what I want to discuss with you today is what is the possible causes, and I think
Mm.
it's a reflux, and then explain that it's micro reflux, later on for sure, and
So
then
that's called
as well as I
micro
will. Yeah,
reflux.
this is a
Yeah.
micro reflux,
Micro
yeah, because the
reflux.
patient is,
Okay.
yeah, micro reflux, and then tell
Okay.
her and the medication that possibly we need to
Mm-hmm.
take, and then and if the medication is not helpful, and then what might we do in the future, either testing,
Mm-hmm.
further testing for what's called H. pylori, and maybe doing a camera testing. Okay.
Yeah. Sure.
Yep. Also, this, I believe I make it in the PowerPoint. 1 minute just to double check. Is anyone hearing me have any question, or all of you become sleepy? Doctors?
Yeah, not sleepy at all, Dr. Sleep.
Okay. Okay. So do you have any question? Any
No, no,
questions?
no question.
No? Okay. So just for you guys to know, also one of the things that you may suggest in the exam, having if the patient come with a reflux or gastritis, you can use the this pillow. Okay, this pillow is very good. The U shape is one for the pregnancy one. Okay, the non U shape one with only the head elevation bit is for the reflux, but the U shape with the head elevation is used for the pregnancy, because this U shape they are using it to support the uterus. So if she's pregnant 7 month, 8 month, then the uterus is heavy and it's compressing in her vena cava and compressing in her stomach, then will give her night symptoms. So just elevating and then the pillow will help her and relieve her symptoms. So this is something that you can suggest. Also, that what we might ask also when the reflux symptoms about coffee and how its coffee is affecting her reflux. This is important. And don't forget the BMI, alcohol we did, cigarette and caffeine. Here is this is a website about giving advices how to make the cafe, the coffee less irritant to the stomach. Okay, so putting a little bit of milk will help, on the coffee, or even drinking decaffeinated coffee would help. But I strongly, if you have time, just go and visit this website and just do further reading. Non-steroidal also need to be asked. Stress, I think you did ask. Don't forget that selective serotonin reuptake inhibitor would cause her, her gastritis. So if the patient is on SSRI, you need to ask about, you need to discuss about a possibility of a changing or decreasing the tablet of her mental health, okay, especially SSRI. This some lifestyle you may go through it, and then these are the causes of metallic taste in a simple picture. Tablets of metallic taste, medication that can cause metallic taste, and here summary of the management of the gastritis. Okay, which already I discussed it, but you can go through that in detail, because each arrow from that is a potential case. Okay, they may bring a case with gastritis with reflux, but have dysphagia, then 2 weeks weight referral, above 60 with weight loss, then you consider what upper GI, so or it's direct CT scanning. So have a read of this diagram, okay? Because it is a potential case in real life. Even in real life, a lot of patients will come with gastritis and then they have pancreatic cancer. So this is can come in the exam for sure, without doubt. Okay. I think I skip a case. The third case will who will do it? Sorry, is Doctor. Uh, uh, Dr. Satwat? Dr.
Yeah, that's me,
Satwat?
Doctor. Yeah,
Okay, okay. Hi, Dr. Satwat. Okay, just 1 minute. So, yeah, 1 minute to open
Dr.
the.
Slim, can you just show that slide about the metallic taste in the mouth, please?
You want to see it?
The differential diagnosis of
Okay,
metallic
yeah,
taste.
sure, sure, sure. Yeah.
Statins is also a cause of
Yeah,
sinus stone.
surprisingly, yeah, the statin is causing that, according to my recent reading, which is something new for me to know, to be honest. Yeah, so statin, yeah, can cause metallic taste. Okay, I thought it's metformin and ACE inhibitor, but obviously statin, can cause as well. So yeah, okay,
Thank you very much.
no problem, no problem. So let's see the last case, and then where is it? Okay, so when you're ready, uh, shall I put the 3 minutes timer? Yeah,
Yes, please.
yeah, sure.
Good morning, Jack.
Yeah, good morning, doctor.
This is Dr. Maurice from the surgery, and how can I help?
Well, to be honest, doctor, I'm a little bit anxious. In the morning, I feel that when I wake up, I went
Yeah.
for a wee, and then after I finish, I'm looking at the loo, and then I find that I'm peeing blood. So I'm not sure what should I
Okay.
do, doctor.
Okay. This must be very stressful for you.
Well, I'm anxious to be honest. I become scared. Yeah, if sure something, yeah, for sure it's stressful. So yeah,
Of course.
so
And had I been in your position, I would have felt scared as well. So tell me more about what's going on.
what do you want to know, doctor?
So yeah, and was it only this once then that you saw blood in the flush?
Well, doctor, yeah, it's not once. Okay, in the morning it was severely red, and then and then I feel that I'm going more often, and there's a little bit of stingy. My urine is very stingy, and then yeah, maybe sometimes it's showing dark red, sometimes light, white red. Yeah, so it's always red, but with different intensities. So I'm not sure. And also, I'm
I
going more
understand.
often. I'm going more often, and this is stingy. Yeah, I never have a stingy urine, and also it's smelly little bits. Yeah.
Sure. So when you said that, I mean, usually it's red. This is what your statement was. So since how long would you say it's going on for? A month or 3 months?
No, no, it's only today, doctor, in the morning when I wake up to
Okay, okay. So I mean the picture's becoming clearer. You have never had this blood in your V before today.
no, I didn't have the blood before that. Yeah.
Okay, so with the blood, I'm just trying to clear things out. With the blood, there was some burning in the urine when and the urine was smelly. You say,
Yes, yes.
okay, um, and you're going a bit too often. Um, uh, uh, have you experienced any pain in your tummy at all?
No, doctor, no, no pain.
Any back pain?
No, no back pain.
Okay, and when you say I mean you're going to the loo a bit too frequently to pass wee, are you feeling that you are more thirsty at the same time?
No, I didn't notice that.
Okay, that's fair. And any recent illnesses like a sore throat or yeah, nasal flu or cold-like symptoms.
No, no, doctor, no.
Okay, have you ever passed any stone in your V?
No, 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 doctor.
Any family history of kidney or bladder issues?
No, doctor, no.
So when we talk about blood and urine, Jack, we try to be as thorough as we can so that we don't miss out anything. Have you noticed any weight loss at all recently?
No, no, doctor. No weight loss.
Uh,
But is it
yeah,
related?
any I'm trying to as I mentioned, trying to be thorough, and once I get my thoughts straight, I'll tell you what I'm talking about or I'm thinking. Yeah.
Sure, sure.
So, change or decrease in appetite at all?
No, doctor.
Any night sweats?
No, no, doctor.
Okay. Um, and finally, Jack, um, are you on bisoprolol and a blood thinner for your irregular pulse? Are you taking the medications regularly?
Yeah, 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 doctor. I'm taking it regularly.
Have you monitored your blood pressure recently at home just to see if it's within range?
Yeah, I'm always seeing, I have this smartwatch from Apple, And I think,
Excellent. Well
yeah,
done.
and this, yeah, and it's, I think it's, yeah, it's always monitoring my blood pressure, and it's always in the right, right numbers. And
That's
my heart rate always also in the right numbers. So,
okay. That's good to
yeah.
hear. And yeah, any thoughts about what's going on, Jack?
But to be honest, doctor,
Why the
I'm not.
blood in the
No, doctor, I'm not sure what might be. I'm not sure.
that's perfectly fine. Any concerns besides those you have already mentioned?
Well, doctor, I'm bleeding, so I'm sure worried. If
Of
this will
course.
continue,
And
or maybe.
okay, and understandably so, Jack. And how were you hoping I'll sport you today, just to see we on the same page?
I'm sure I just need to understand what is happening. And there is another thing I noticed also, doctor. I'm not sure
Yeah.
is it related or not. I feel that you know I'm there is some whitish thing is coming out from my 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 penis. I'm not sure,
Okay.
like I'm always, like there is continuous Siemens coming out. I'm not sure is that Siemens or not, but I don't know. Is
I see what you're trying to say, Jack. So may I ask some sensitive questions when when you report this?
Yeah, yeah, sure, doctor, go ahead.
Are you sexually active?
Well, doctor, I just came from Thailand. I spent about
Okay.
10 days there. And when you go to Thailand, you are going for fun. So yeah,
Yeah. Yeah.
to be honest, I was a little bit irrational, I think. Yeah, I went there, and
Oh,
every
okay.
day I
So
was with different partner. Yeah.
okay. And when you say you were a bit rational, were you observing safe sex at all?
I don't think so. I didn't use condoms. Stupid me. I didn't use condom. Yeah.
Okay, and just a quick overview of lifestyle measures. Do you smoke at all?
No, doctor, no.
And alcohol?
No.
Okay, so thank you for all this information, Jack. When you tell me about a smelly urine and a whitish discharge from your penis after a fun holiday in Thailand, it comes to mind that most likely you're having what a condition we call as sexually transmitted diseases or disease.
Okay. Okay. And
Yeah.
this will make me bleeding.
So actually, this can lead to urinary tract infection. Yeah.
Okay.
And
Okay.
as a result of the infection, you can bleed.
Okay. So do I have then sexually transmitted disease, and I have infection in my wee? Is that what you're trying to say? Both?
And both. It can be until and unless it's proved
Okay.
otherwise. Yeah.
Okay.
So
Okay.
the best way around this is, Jack, we need to do two things.
Okay.
Firstly, I would really want to see you in clinic this afternoon. Are you okay to come over and for a face-to-face a chat and an examination as well?
Yeah, sure. What you want to examine?
So, firstly, I'll do your blood pressure and your pulse. I understand you have a smartwatch, but to do it in clinic myself, yeah. And then, I will have a feel of your tummy,
Mhm.
and I'll examine you down below as well to see whether there's any pain of your testicles, and if I can take a sample or a swab of your discharge. Yeah,
Okay,
and
sure.
yeah, if possible, can you bring over a urine sample such that I can test it in clinic?
Yeah, I don't have container, but for sure when I come, I can give you some urine. Yeah, I think I will hold myself. Yeah, yeah, I will hold myself, and once I reach the reception, I will take a container. Sure.
Thank you very much. That's very
You're
helpful.
welcome, doctor. Thanks.
And the other thing I would really want you to do is, when you are in clinic, I'll give you a list of our local sexual health clinics. If you can
Okay.
go and visit there. What they would do, Jack, is that they have a more specific specific ways of testing for bacterial and viral sexually transmitted diseases.
So do you want me to go to the sexual health clinic?
Yeah. If once you come over here,
I will feel shame, doctor. You know, I'm 65. What they will say, you know. Yeah,
uh,
I'm realizing now that I was irrational doing that. I'm not a child anymore. I'm not young, that young to do these, you know, these things. So, you
Jack,
know, yeah.
I totally understand, Jack, that you're feeling embarrassed. But I mean, I can assure you, everyone there is a professional, like we are, and no one will be judgmental in treating their patients.
Okay, I will have a thought, doctor, but I don't think I will be able to go, but I will have a thought. Well, just a simple question, doctor, because now I become more worried. Could be, I heard about, the news now, the prostate cancer, and everyone is worried about. Could be prostate cancer, doctor. Yeah, but
So see,
then this may be punishment, this may be punishment from God to me now for what I
uh,
did.
no, no, Jack, I don't think so. That's cancer. Please do not worry about the punishment. Why I say that is because you do not have any weight loss or change in appetite. However, you have signs and symptoms of a sexually transmitted illness and water infection, given your blood in V and the discharge from your penis. Let's treat that first going forward, and then we'll talk. We'll discuss this concern of cancer going forward.
Sure, thank you, doctor. Thank you. I
Thank
will
you.
see you today. Yeah. Okay, what do you think?
Lot
I'm
of
just
things.
yeah. Can just I double check your name just because I don't want to pronounce it wrongly. It's not Safwat, yes, not Safwat. So what's your name if you don't mind, doctor?
No, I'm
Mm.
Satat Moeed. So I'm
Safwat.
yeah,
Okay, okay. Sorry. Okay, Safwat. Okay, but
yeah. So
okay, Safwat
mostly
Moid.
people know me. Yeah, mostly people know me by Moeed. Yeah.
Moid. Okay, Doctor Moid. Okay, so can you reflect? How did you feel, and what you might do, do it, differently in next time.
Sure. So
Your exam is 11, isn't it? 11 of this month, September. First day as well. Wednesday?
come again.
Your exam, Wednesday?
Wednesday is the first attempt. Yeah.
Okay, you will have the exam on 11th of September, isn't it? Yes?
No, I'm
The
not on the
first,
first day.
so which day you are on?
I'm on the 13th, the
13th.
last
Okay,
day.
the last day. Okay.
Yeah.
13th. Okay. So how do you feel? Tell me.
So, Dr. Sleem, I mean, initially I thought this was microscopic hematuria, a station of microscopic, but it happened to be macroscopic. So, I tried to cover most of the things, but yes, when you said that there was some white semen coming out from the penis, that's when I understood that I've left out sexual history, and I tried to cover up.
Yeah, and that's good. That's so next time you will not forget. Okay, I
Yeah,
meant to guide you to it because if I just continue, this will not be registered in your brain. So, okay, so now it's
yeah,
registered. So next time you will not forget it. So if the patient complaining from anything down below, you need to ask about the sexual history. Okay, there is
definitely. Thank you very
no way not to ask. Okay. And
much. Thank you very
this was the trick in that case, because I know sexual history is difficult for most of us to ask about, but you should not feel shame. You are a professional. You need to ask, especially if a female talking with a male or the opposite sex. If everyone, the people will feel a little bit shy, but if you ask it in a professional way, you are a doctor. And no one will tell you why you are asking. Okay, if you are asking and giving a reason why you are asking, it's completely fine here with the culture. Okay.
Thank you very much, Dr. Slim. And then,
Okay.
when I started with the sexual history, I was at time minute, I think either
The
6 or
time was
5.
past. Yeah, I know. I know. Yeah.
Yeah, so
Yeah.
then that's why I rushed, and I wasn't able to take a history of what his work was. But I mean, in my management, I brought him face to face, and I mean, an examination, and swabs, and a urine dipstick, and then gum clinic referral. Yeah.
Okay, that's very good. You did a lot of things that are excellent. Just a few notes, okay? The
Sure.
first thing, when a patient is coming with bleeding, please, please, please don't start your consultation without making sure that the patient is safe or not. Okay. Well, I saw people
Yeah.
dying from hematuria. I saw people, I came, my background is an emergency physician. So I saw people dying from hematuria, especially if they are in Adixaban or rivaroxaban. Okay. So if a
Yeah.
patient coming telling you I am peeing blood, or then you need to make sure is he hemodynamically stable or not before proceeding to your question. Okay. If a patient
Absolutely.
coming telling you I'm vomiting blood, then you need to make sure that he's not vomiting, massive blood and he's unstable now. If the
Absolutely.
patient is passing blood from his back passage, you need to make sure he is stable. If a patient coming with the chest pain from 2 3 hours, is he stable now or not? Does he have chest pain now or not? So if the patient is telling you I'm bleeding, we'll say okay. Don't say okay because okay also is dismissive. I understand that you are bleeding, you are weeing blood, but just before proceeding, before asking you few further question, I need to make sure that you are safe and well. Okay, do you feel that you are dizzy or do you feel that you are generally tired? Okay, do you feel that you are more thirsty than usual? Do you feel your heart is racing now? No, doctor, nothing from that. Then good. So most probably we can proceed with our consultation and then go ahead and start to ask him. Okay, this examination more about safety. So if the examiner, even if you have a lot of information and you're brilliant with your information, if you are not a safe doctor, they will dismiss your information. Okay, they already examine your information capabilities and the AKT. Okay, in this
Yeah.
exam, they are seeing how you are applying your information in the real practice. So if patient is bleeding, you need to make sure that he's stable. Okay.
Yeah. Thank you very much.
Okay, this is the first thing. The second thing, you already it's written for you blood in the we, and you tell me how can I help you? I would rather please try to use pre-existing information. Because
Okay.
it's written here that you are weeing blood, so just can you tell me how that started? And I told you it's in the morning, and then I feel that you are keep asking me when it started, how long it's been started. So this will make the patient himself feel that you are not listening to him,
Yeah.
and
Yeah.
the
Yeah.
patient will not help you. Okay, so if the actor didn't like you, he will not help you. So and the only way to make the actor like you is by making him feel that you do care. And the first thing is to listen to the patient. If the patient feel that you are not listening to him, then you don't care about me, and then I will not care about you. Okay, so be cautious about that. If the information given to you, don't keep asking, or if you feel that you are repeating yourself, then you need just to risk it. I'm so sorry, I think I'm repeating myself. You did ask me, but I didn't get it precisely. Can just I ask about this and that and that? If you feel that he already told you the information and you didn't get it, okay. um
Definitely.
yeah, and then I did hear that you ask about back pain, tummy pain. I guess that you are excluding sinister causes of probable hematuria, maybe. Is that right?
Yeah.
Okay, but then you keep asking some another few question, and then you ask me, did you lost your weight, isn't it?
Yeah.
So if you feel that you forget asking something in its right place, just say, I meant to ask you about that. Did you lost your weight? Okay. And
Yeah.
me personally, I don't like someone, I don't like asking patient, did you lost weight? Because he may ask me, yes, doctor, I lost weight because I'm doing exercise. I'm running 500 miles a week or something, okay? Or doing more exercise to lose weight. When you ask about weight, did you notice you are losing, you did lost any weight unintentionally, unintentional weight loss, okay? So not normal weight loss, because he may lose weight because he's trying to lose weight. Okay, then this will mislead you. So just say, did you notice any unintentional weight loss? Okay, it's few
Yeah.
tweaks, but it's possible, and you can ask it. The other thing, I didn't hear much about your differential. Again, if you can tell, well, changing your the color of your wheat can be due to a lot of causes. One of them, what you eat, for example. Did you eat today a lot of beetroots, for example? Then, did you, and go on and go on and ask about the differential of your, of the hematuria. And one of them is prostate issue. I didn't hear also about, did you ask about prostate? You did ask about family history of a neurological problem, and that can be under the prostate part. But again, I didn't hear anything that may be related to prostate. That's why I told you, oh, it can be prostate cancer or not, because I didn't feel that you excluded, you know, up, isn't it, in the first half of the consultation? Because
Yeah.
it
Yeah.
might be the patient still having prostate cancer, isn't it? And it's just becoming coincidence that he had a UTI and STI at the same time, isn't it? So it's originally what he have is an STI presented with the UTI manifestation, but this doesn't mean that he doesn't have a prostate cancer.
Yeah. Yeah. Absolutely.
Because because we didn't explore that in the first half of the consultation. Still, you don't have sufficient evidence that he have prostate cancer or not. People with prostate cancer will be more prone to have UTIs because of the stages of the urine, and more prone to have STIs. Okay,
Yeah.
so in your differential, you need to well, if you feel that you forgot to ask, and then in the management, well, there is a lot of causes, might cause you, or a lot of causes that might make you wear blood. One of them, which is most probably that what you have is an STI, based on the fact that you went to Thailand and you have this unsafe sexual intercourses, which is presenting with urinary tract infection. But there is other possible differential, which is less likely in your case, like you may have prostate infection. Okay, prostatitis is one of the causes as well, and you need to ask about prostatitis symptoms. Okay, like deep pelvic pain, pain during defecation, and these need to be asked. Okay, and the other a cause that's also less likely in your case, that if you have a growth in your prostate. However, when you come to me, I will do some examination, and during your examination, you need to mention that you may do PR examination for him. You are already bringing the patient in. You will dip the urine, and perhaps you will find the UTI, but it's not unwise. And the same time, you do PR and like, examine your prostate, his prostate. If you do PR and you find hard lumpy prostate, then this could be an prostatic cancer. Could be, why not? And then masked by the infection. For sure, you will treat the infection first, and then you will take the prostate issue on board. But at least you already know that you need to bring him after the treatment to come for further investigation. Or you might be doing a PR, and then the patient will just scream from pain, because if you have acute prostatitis and you did a PR, it will be painful. Then the prostate most probably included in the infection from the STI, and then you need to do an extended course of antibiotics. Then it will not be just simple 7 days course or 5 day course. You need to give the full blown 21-day course. So that's why it's important, not to completely dismiss prostate in a case of hematuria. You need to bring him in, And the other thing also, his tablet, where you need to tell him, yeah, we'll do blood tests. One of them, the bleeding profile, isn't it? Because he's in Abixaban, maybe the Abixaban did that. Yes, it can, most probably it is the STIs, but again, you need to exclude the other causes to be sufficiently, um, you know, excluding all the other causes, isn't it?
Yeah,
Is that
yeah,
clear?
definitely.
Yeah, yeah. And then in the
Yeah.
management, the ice, you did ask about ice. Yeah, I write here. Yeah, and then the PR. So such cases, you will bring the patient, start treatment of the infection. I didn't hear sufficient, maybe, you didn't convince him to go to the sexual health clinic. So if you have time to, to try to make him, go to the sexual health clinic, what you would say?
I would say if um, it is very important to get yourself checked to to rule out any sexually transmitted illness and be treated appropriately.
Okay, but doctor, you are doctor, so you can treat me properly and you can do the needed investigation, isn't it? So, please, I don't
So
want to go. I'm
yes.
a patient now. I'm a patient now. Okay, I'm not a doctor now. I'm a patient now. So please, doctor, just don't put me in this. I'm very embarrassed. I can't go.
So I totally understand, Jack. And I mean, if you are hesitant in going, I will do a few urine tests. But those urine tests need to be early morning, and they will only pick up diseases such as chlamydia and gonorrhea. However, I won't be able to do sophisticated tests to pick up other STIs, like for example viral causes of sexually transmitted illness. These tests and swabs are only done at the gum clinic.
Okay, doctor. So what you mean, please, by viral causes of sexually transmitted infection? What you mean? I'm not getting. What is that?
So sure. So sexually transmitted illnesses can be due to bacterial, yeah, infections and viral infections. So
Mhm.
viral infection needs sophisticated swabs. For example, like herpes virus. They
Okay.
can also cause,
Uh,
yeah.
okay, got you, got you. You can just like that. You will keep losing your time. Just tell him. Well, there is other type of infection that we cannot investigate for it, like HIV. Everyone knows what is HIV, which is AIDS. Okay, and hepatitis. And everyone in the UK knows what hepatitis is. And I strongly advise you to go to the sexual health clinic because they can do this investigation and full stop. That's it. No need to, and the other thing is, if he's still refusing, then some dineries are offering online, express kits. So he can just go anonymously on the website of this, of the iCash or the sexual health clinic and just order a kit that will deliver to his house through the post without his name. It's only with the address and the phone number, where he will do urine test. He can do self swabs, and he can also, they will give him bin prick, where he can prick himself and drop his bloods in tubes and send it back to the sexual health clinic. They will do the needed investigation. And if they find it positive, they will send him a message at his iPhone, at his phone, and then they will call him to come. Okay, so this is one of the things that you can, convince him with. Okay, the other thing you need to ask, if you have time, if he came when he came from Thailand, did he have any sexual intercourse or not? Because then they will need to do contact tracing for sure, the sexual health clinic, which you can convince him also with this. Well, if you have other sexual intercourse, so you might infected other people, and then they need also to be treated. This is the right, okay? Is it clear?
So,
Uh,
yeah, yeah. Dr. Slim, just I just didn't understand
yeah.
on online. What is the name of the site?
No, it's different from place to place. In my dinery, it's iCash. You can enter and see it. Okay, you can do that now, so everyone will will understand. Will stick. This will stick in everyone mind. So if we press here iCash, cash. So iCash Express test. So are you seeing? So iCash Express test, okay, it's in the east of England. So you'll just choose, hello?
Yeah, yeah, yeah.
Yeah.
We are here,
So
doctor.
you can just choose wherever you are, and then you will
Yeah.
write your age, postcode, gender, register, and then they will send it to you within 48 hours to your home,
Okay.
and then yeah, through the Royal Mail, okay, and then you will return it back for free, no payment, and anonymously. They will not see you. They will not know who you are. Okay. And the other thing, when I hear from you, you said bisoprolol blood pressure. Most of I didn't give this information here, but most probably he's using the bisoprolol for his AF, not blood pressure. Okay, most probably. Okay.
Okay, okay, yeah.
Yeah, so just you may ask him, you are using the bisoprolol for the blood pressure or the AF, but in this case, most probably for AF, not for blood pressure. What else I want to tell you? So management of this case, so you will bring him, do the PR, do the urine test, prescribe the antibiotic. What antibiotic you will prescribe for such patient? And for sure referring him to the gum clinic. But if he is resistant and maybe will not listen to you, but what antibiotic you would prescribe for such patient?
So I would prescribe him doxycycline, 100 mg BD, 2 weeks, plus ofloxacin, 200 mg BD, 2 weeks.
Okay, why? Yeah, that is good, but why? Ofloxacin, yeah.
Come again?
Yeah, why you added the ofloxacin?
So that's broad spectrum for prostatitis.
Yes, but still you didn't know, yes? You didn't bring him back here and they did do
Yeah,
examination
yeah.
of PR. You still don't know that it's prostatitis, isn't it? Yeah, you are right. If he is prostatitis, you may prescribe the combination of these two drugs. Okay, although maybe ofloxacillin will be enough, perhaps. Okay, I think it's covering atypical bacteria like chlamydia. But I think at this point of consultation, you don't have sufficient data that this is a prostatitis case. So I would say, yeah, I would prescribe for you doxycycline 100 milligram twice a day for 7 days, and you may prescribe for him one dose shot of ceftriaxone because if a patient having frank pus coming out from his penis, most probably he have gonorrhea, and the doxycycline is not covering gonorrhea. Ceftriaxone one injection can be okay. Most probably this will not be available in your clinic. He may buy it from Boots or somewhere else and bring it to you, especially if this patient coming on Friday and then until the iCash until he contact iCash or having the kits. This will take at least 4 days because the weekends they are not working, isn't it? So you may consider prescribing a Kiftriaxone for sure. If he came in and you examine him and you think it's prostatitis, then you will prescribe the ofloxacillin. But I think it's not 2 weeks; it's 21 days, I believe so. You may review it. Okay.
Thank you very much,
Okay,
Dr.
yeah.
Salim.
The other thing then after that, what is the future plan? So you need to say that in the management. If you after your treatment, you need to come in. We'll repeat your we will do urine dip. We will bring you in. We need another sample from you. We'll dip your urine. If we still find it a little bit of blood, which is something we call it's microscopic hematuria, blood that you cannot see with your eye, then we may consider further investigation. And then the investigation depends on the age of the patient. Okay, if it's more than 45, and there is no specific reason for his microscopic hematuria, we may, you may send him for the 2 weeks wait. Okay. I did put in the PowerPoint, uh, yeah, I did put in the PowerPoint the Frank hematuria algorithm. Okay. Please everyone to go through it, because at each point it is a potential question. So if we go through it here, so you can see any symptoms of UTI. I would add here also STI. Yes, then you need to treat the patient and then bring him back for urine dip after 7 or 14 days. Okay, if he still have microscopic if he have microscopic hematuria, or the UTI is not confirmed, then you need to go further investigate that. If he is less than 45, then investigate with ultrasound PR and renal function, and then see what it might be. It might be, IgA nephropathy. It might be polycystic kidneys. It might be a lot of things. Okay. And according to the investigation, you will proceed. But if it's more than 45 and he have, persistent unexplained microscopic hematuria, you need to refer him to the 2 weeks wait. Okay. This is the male side. But if she is a female, then you may also consider doing an ultrasound transvaginal, okay? Because a lot of endometrial hyperplasia or endometrial cancer can present with microscopic hematuria as well, okay? So macroscopic, and then if persistent microscopic, it can be something related to her uterus. So you need to consider that, especially if she is more than 55. Okay, so you can look at the algorithm, and if there is anything you just ask in the group, I'm more than happy to answer. Okay, is that clear for all of you guys, doctors? Yeah, we
Thank you.
decrease
Thank you
now.
very
We was
Yes.
11, now we are 8.
Yeah.
So two people escape. Is it a lot? I'm so sorry. It's meant to be 1 hour, but it's just it's just the discussion now. Become 2 hours. I hope you learn something from me.
Yeah,
And
a lot.
I wish you all the best in your exam. Just if you have any question, just send me a message at the group and I will answer. Okay. Please hold your nerves. Okay. This is not life or death. It's an exam. You will pass it sooner or later. Okay. It just needs time. Okay. And in the right time, you will pass. Okay. Don't
Thank you very
stress
much, Dr.
yourself.
Slim. It was
Don't,
excellent.
no problem at all. No problem at all. Don't stress yourself, okay? And be confident. Okay. Most of you are
Thank
doctors for a long time. Okay. It's not one, most of you at least now 3 years of being doctor at least. Okay. So be confident. You are not less than anyone who passed the exam. Okay. Be
thank you.
positive. You will pass, inshallah.
Um,
Okay.
thank you,
Any
inshallah.
question
Thank you.
before the finishing? Any question, guys? Any question, doctors?
Sorry, Salim, just one
Thank you.
thing. Is it okay if I ask on the group, like if anyone free to practice the day?
Yeah, sure. Why
I
not? Yeah, yeah, yeah,
Yeah,
yeah, yeah.
okay,
Yeah,
yeah, sure.
anyone, yeah, whatever. It's your groups, guys. You can do whatever you want in, and please feel free to invite any of your friends. I may put I will put this link will be still working. So after I stop the recording, so I will stop it now. So after the stop the recording, okay, if it will take some